Science Speaks!
Pinch yourself. No, seriously, go ahead, pinch yourself. Do you feel that little bit of pain? Could you imagine a world where you wouldn't be able to feel pain? A world where you wouldn't feel those nasty little paper cuts? It'd be pretty great, right? Well, think about it again. Could you imagine breaking your ankle and walking around on it for weeks before you'd realize something was wrong? A world where biting your tongue wouldn't make you stop, but you'd keep going? For someone like Ashlyn Blocker, that world is a reality. On the outside, she seems to be a perfectly normal 13-year-old girl. She goes to school, she plays music, and wears flip-flops most days. However, on her left palm, she has severe scarring from when she was little and had prolonged contact with a hot engine. Every night before she goes to bed, she needs to wear a night guard to make sure she doesn't chew off parts of her tongue and grind her teeth down to nothing. And when she was little, she learned to stop doing something, not because it hurt, but because she saw blood. Ashlyn Blocker doesn't feel pain. In a normal individual, pain-sensing nerves along the body's surface fire more rapidly when we touch something sharp or hot, sending electrical signals to our brain, which causes us to react. In Ashlyn's case, she has a dysfunction with nerve growth factor, which causes these pain signals not to be sent properly. So, what is this nerve growth factor? Nerve growth factor is a small protein found in our body that has importance for the growth and maintenance of nerve cells, and as seen with Ashlyn's case, is important for pain signaling. Several other growth factors have been identified with similar functions. Collectively, all these are known as neurotrophins. Clinically, there are very few therapeutic options for the treatment of pain. Drugs like anti-inflammatories and opiates are the standard of care for chronic pain management. These options have limitations and many side effects. People become tolerant to these drugs and even become addicted. The pharmaceutical industry has recognized that no new pain treatments have emerged over the last 30 years. They now focus their drug discovery programs on creating new treatment plans for chronic pain without these seen side effects. So far, the only method of blocking the effect of nerve growth factor that is made into clinical trials is the use of a nerve growth factor antibody. This antibody binds to the nerve growth factor protein and stimulates your immune system to attack the cell. Our lab team is currently working at blocking the effect of nerve growth factor using a different mechanism. We are working on identifying small molecules which can bind to the nerve growth factor protein and block its action on its receptors. These small molecules are 1,000 times smaller than the nerve growth factor protein. Think about that, 1,000 times smaller. That's like this little pebble being able to knock down your entire house. The benefit to looking at these small molecules is that they hold more acceptable characteristics for the use of a pharmaceutical drug. Even though the main application for these small molecules is directed towards pain treatment, this technology has the potential to aid in other neurotrophin dysfunctions, such as Alzheimer's disease, Parkinson's disease, spinal cord injury, and diabetic neuropathy. So I ask you again, pinch yourself. Really pinch yourself good this time. Do you feel your nerve growth factor at work?